Welcome back, medical billing students, to part 12 of our Explainer series. Today, we are absolutely laser-focused on a massive sector of government payers, one that serves some of our nation's most critical populations. Think of this as your ultimate guide to demystifying the whole complex web of military and veteran health benefits. Seriously, if you've ever felt completely overwhelmed by the sheer number of acronyms in government billing, believe me, I've been there, you are in exactly the right place. Let's get into it. Okay, let's dive right into our agenda. We're going to cover 1. Introduction to military healthcare, 2. Tricare plans and analogies, 3. Regional claims and administration, 4. Understanding CHAMPUS VA, and finally 5. Summary and next steps.
Section 1. Introduction to Military Healthcare.
My goal with this explainer is to give you the coding and billing agility of a cheetah when you encounter these specific pairs. First things first, we need to establish the sheer scale and authority of the Department of Defense as a primary government payer. When we talk about military healthcare, we are talking about a highly regulated, federally backed behemoth. Unlike your typical commercial insurance plans, the ones funded by private premiums and employers, Tricare is funded and administered directly by the United States Department of Defense, or the DoD. That creates its own very unique billing silo. Because it's backed by the federal government, it operates under very specific statutory rules. Meaning, as a medical biller, you have to follow their operational guidelines to the absolute letter if you want to secure reimbursement. There is literally no wiggle room here.
Before we break down these specific plans themselves, we have to know exactly who qualifies for this coverage umbrella. Tricare provides health coverage for a very specific, dedicated community. We're talking about our active duty service personnel, retired active duty military, retirees from the reserve military, and of course, their eligible family members and dependents. It's pretty straightforward. If a patient doesn't fall into one of those specific DoD categories, they simply are not a Tricare beneficiary.
Section 2, Tricare plans and analogies.
All right, we're transitioning to the core structural pillar of this explainer. The absolute genius of the Tricare system is that it actually mimics the civilian healthcare world through very clear structural analogies. And this brilliantly illustrates exactly how you can memorize these plans. Think of these commercial equivalencies as mental badges you can just pin on each Tricare plan. Tricare Standard, well, that functions analogously to a civilian PPO, offering freedom to use any civilian provider. Tricare Prime is your HMO equivalent, where care is strictly confined to contracted network providers. And Tricare for Life is basically a Medigap policy, providing secondary gap coverage for Medicare. Locking in these analogies will instantly clarify how these military tiers function in the real world. It's like a cheat code for billers.
Let's contrast those first two a bit more closely, just to make sure we've got it. Tricare Standard, our PPO analogy, gives beneficiaries the freedom to seek care from any civilian healthcare practitioner they choose. However, as we all know, with that freedom comes cost sharing. Patients are responsible for paying annual deductibles and standard coinsurance amounts. On the flip side, Tricare Prime, our HMO analogy, is much stricter. Beneficiaries are restricted strictly to seeking treatment from contracted network providers. It's also mandatory. All active duty service members are strictly required to join Tricare Prime. No exceptions. Now, for qualifying dependents, it represents a highly cost-effective managed care option, provided they stay within that network.
Then we have Tricare for Life. The specific target demographic here is military retirees who previously participated in Tricare and subsequently became eligible for Medicare. Once they transition to Medicare, Tricare for Life steps in as a secondary gap function. It operates as a wraparound Medicare supplement policy, just like a Medigap plan, to cover out-of-pocket Medicare deductibles and cost sharing. It is absolutely vital to remember that in this specific scenario, Medicare is the primary payer and Tricare for Life is secondary.
Section 3, Regional Claims and Administration. Let's move along and see how all this theory builds into the daily reality of medical billing. Now that we understand the plan structures, we have to understand the logistics of how to actually route and handle these claims. Within the United States, Tricare administration is geographically compartmentalized into 3 designated regional contractors: Tricare North, Tricare South, and Tricare West. It's simple geography. Knowing exactly where your practice is located dictates where your claims are routed. And for service members stationed or traveling internationally, well, claims incurred overseas are routed through a completely separate entity called the Dedicated Tricare Overseas Program. So, the crucial point here, the absolute golden rule of Tricare billing is this. While Tricare is the Department of Defense program and reimburses providers based on its own established Tricare pricing fee schedules, it borrows heavily from CMS when it comes to compliance. Tricare utilizes the exact same claim editing processes as Medicare. Listen closely to this. If your claim, wouldn't pass a national correct coding initiative edit for Medicare, there's no way it's passing for Tricare. It's going to get denied. You must adhere to those strict adjudication standards. This brings us to a really pivotal question. We established these specific DoD criteria earlier, right? But what happens to the beneficiaries who explicitly do not qualify for Tricare? This creates a clear, hard boundary between Department of Defense funding and our next major topic. Let's find out where they go. Section 4. Understanding CHAMPUS VR. Now, what's really interesting here is that for those who fall outside the Tricare umbrella, we look to the Department of Veterans Affairs. Let's introduce this specific exception to Tricare and point out the major shift in government departmental authority. We have officially left Department of Defense territory, folks. The funding stream has completely changed. We are now dealing directly with the Veterans Administration, which has its own completely separate budget, its own oversight, and its own rules for claim management. This specific program is called CHAMPUS VA, which stands for the Civilian Health and Medical Program of the Department of Veterans Affairs. The absolute key takeaway you need to remember here is its exclusivity. This program is dedicated solely to beneficiaries who are locked out of coverage under Tricare. The eligibility rules here are incredibly strict, and they're based on tragic but necessary criteria. CHAMPUS VA covers spouses or surviving spouses of veterans who became permanently and totally disabled from a service-connected disability. It also covers the surviving spouses and dependents of veterans who died as a result of a service-connected condition. Remember, if the patient is an active duty service member, they use Tricare. But for these specific dependents of permanently disabled or deceased veterans, CHAMPUS VA is their dedicated lifeline. Now, as an entry-level coder, you might hear older providers or veteran billers use the term CHAMPUS generically. So it really helps to understand the history so you don't get confused. Originally, active duty members and their dependents got all their care strictly at military institutions. Eventually, due to budget limits, the DoD had to start contracting out with civilian providers. This legacy program was the original CHAMPUS. Over time, for the specific dependents we just discussed, that legacy program transitioned into CHAMPUS VA, which is entirely funded and managed by the Veterans Administration. Meanwhile, the DoD evolved its main civilian care branch into what we now know today as Tricare. Makes sense, right? Section 5, Summary and Next Steps. Wow, we have covered a tremendous amount of ground navigating the complexities of military and veteran health coverage today. Let's transition into our final wrap-up phase to cement your retention of this material before you put it into practice. Here are your rapid-fire takeaways. First, the Department of Defense's Tricare program covers active and retired military and utilizes brilliant commercial analogies. Standard is your PPO, Prime is your mandatory HMO, and Tricare for Life is your Medigap policy. Second, Tricare routes claims based on physical regions like North, South, and West, but fundamentally mimics strict Medicare claim edits for adjudication. Don't forget that golden rule. And third, CHAMPUS VA is a completely separate entity funded by the Veterans Administration exclusively for the dependents and spouses of totally disabled or deceased veterans. Keep those distinctions clear and you will process these claims flawlessly. You are well on your way to mastering government payers. Coming up in Part 13, we are going to tackle another massive federal entity, federal workers' compensation programs under the Department of Labor, including the OWCP and FACA programs, along with coal mine and energy workers. It is a whole different ballgame of pre-authorizations and accepted condition codes that you definitely won't want to miss. So as the lines between military and civilian healthcare continue to blur, how will these rigid billing structures evolve in the future? Something to think about. Like, share, subscribe to Decode Healthcare with Harshal.